If you guys are anything like me, you've probably developed a little bit of some hand problems over the years. I have very petite wrists, and I always wanted to do very deep work, but I would almost like over compress my wrists in a way that would feel uncomfortable. When I learned elements of Thai massage and blended it into my work, I learned how to use my hands in a slightly different way. So if I was trying to apply pressure to Kristen's calf here, I'm using my fingers just to get a feel. But if I decided I wanted the big, broad compression, how's that spot right there, Kristen?
Good.
Okay, you can take more pressure there?
Yes.
Okay. So I would lean in with the hand and you'll get this little bit of a crease, which you can always minimize. That's going to help some. But I want to be able to sink down. The way that I would do this was to reinforce with another hand, and that would take the pressure off of just pressing and compressing my wrist right there. So I could come in with a second hand. If I decided I needed something sharper, you doing okay, Kristen?
Yes.
She does a lot of snowboarding, her legs are tight. If I decide to use my thumb, you'll see that I'm not pressing my thumb down, I'm not hyperextending a joint, I'm just pressing flat. How's that right there?
Good.
Okay. Then I'll take my palm and reinforce the thumb, because what I'm doing is using the palm to press the thumb into her leg. It feels supremely deep to her, but it's much less strain on me. Once I have, ooh, I make her submit that way. So if I use just a thumb and I decide I want a little bit less pressure, maybe I want more pointed right over the nail here above this first joint, I can take the other thumb and press down on top. Lots of different options for reinforcing. If I go a little bit higher and I wanted some flat knuckles right here, so not pointed, really a flat portion, I could come in, put a second layer right there. How's that, Kristen?
Good.
Okay, not too much?
The edge.
Right at the edge. All right. If I hold right there, what if I go up towards the knee or down towards the feet?
Towards the feet.
There we go. What about to the posterior or to the anterior?
Posterior.
She gave me the, oh no. How about there? Backed off just a hair. Is that better?
Yes.
There we go. That means that I'm able to maintain and use my hands in a way that has some integrity. It means that I'm still using my fingers, but by reinforcing, I'm not just using these small muscles to use pressure, which means that I'm going to save my hands and prevent so much strain on my carpal tunnel.